What happens to your brain? Every minute you ignore these warning signs. It started with a headache, not a bad one, just pressure behind the left eye. Margaret, 67, a retired school teacher from Cincinnati, Ohio, assumed it was dehydration. She drank some water, took an ibuprofen, went to bed. She woke up the next morning and couldn't move her right arm. The stroke had been coming for 3 days. Her brain had been sending signals the entire time. She missed every single one. Today, I'm going to show you exactly what those signals look like, and more importantly, what is happening inside your brain during every minute you choose to wait. Because waiting is the decision that changes everything. I've spent over 30 years in internal medicine and cardiovascular research, and I created this channel because what I'm about to tell you should have been said in the exam room, not discovered after the damage is already done. Before we go further, drop your age in the comments right now and tell me, have you or someone you love ever brushed off a symptom that turned out to be serious? Your answer matters. It helps everyone watching this video find the courage to act faster than you did. Here is the number that should terrify you into paying attention. Every single minute a stroke goes untreated, 1.9 million neurons die. Not slow down, not struggle, die. Permanently gone. In 10 minutes, that's 19 million neurons. In 30 minutes, that's the equivalent of almost 3 years of normal brain aging, wiped out in the time it takes to finish a cup of coffee. Now, here is what no one tells you. Most strokes don't arrive without warning. The brain almost always sends signals first. We call them transient ischemic attacks, TIAs, mini strokes, temporary blockages that clear on their own within minutes. They feel minor, they pass quickly. And that is exactly why they are so dangerous. Because when a symptom disappears, most people decide it wasn't real. They talk themselves out of it. They wait, they hope, and the brain keeps the clock running the entire time. There are 5 warning signals your brain sends before a major stroke. I want you to memorize every one of them, not because you might need this information someday, because statistically, someone in your life needs it right now. Warning signal number 5. The curtain over one eye. You're walking to the kitchen. Suddenly, one eye goes dark. Not blurry. Dark, like someone pulled a curtain down over exactly half your vision. You blink, you rub your eye. 30 seconds later, it's gone. Most people blame it on standing up too fast, screen time, tiredness. They move on with their day. Here is what actually happened. A tiny clot, or a fragment of plaque, broke away from the wall of your carotid artery, traveled upward, and briefly blocked the artery that feeds the retina of your eye. That artery is not isolated. It is a direct branch of the internal carotid artery that feeds your brain. That clot missed your brain by 2 millimeters. Neurologists have a Latin name for this, amaurosis fugax, fleeting blindness. When a patient describes this symptom, neurologists treat it like a fire alarm. Urgent evaluation. No waiting. No, let's see if it happens again. Because hospital records show a pattern that should stop you cold. Patients who experience 2 or 3 of these episodes and ignore them, the next event is often not in the eye. It's in the brain. Warning signal. Number 4, your skin goes wrong on one side. You're sitting at the dinner table. Without warning, your left hand feels like it's wrapped in cotton. Or the left side of your face goes numb. Pins and needles that came from nowhere. A few minutes later, normal again. You assume you slept on it wrong, or it's circulation, or stress. But here's what separates a stroke warning from a pinched nerve. Stroke symptoms are almost always one-sided. That's not a coincidence. That's anatomy. Each hemisphere of your brain controls the opposite side of your body. When blood flow is interrupted in one hemisphere, only that side goes offline. Both hands going numb equally, more likely a spinal issue, one hand, one arm, one side of the face, suddenly without cause resolving in minutes, that is a strong reason to call your doctor today, not next week. Warning signal number 3. You suddenly can't walk straight. You're on a flat surface you've walked 1,000 times, and your foot lands wrong. Your leg feels rubbery. You grab the wall, or you're hit with a spinning sensation so severe that you reach for a chair even though nothing moved. The cerebellum sits at the base of your skull. It governs balance, coordination, the precise firing of every muscle that keeps you upright. It receives its blood supply from arteries running up through the bones of your neck. When those arteries drop pressure even briefly, the cerebellum glitches. You stagger, you veer, you feel violently dizzy for no reason you can name. In clinical practice, this is the warning sign most commonly written off as bad shoes, low blood pressure, or inner ear issues. But spontaneous, intense dizziness, combined with any loss of coordination, is a possible TIA until a doctor rules it out, not the other way around. Warning signal number 2, your words stop working. This one is different from forgetting someone's name, different from losing a word when you're tired. I want you to understand what a speech warning actually feels like. You know exactly what you want to say. The thought is fully formed. But when you open your mouth, what comes out is slurred, fragmented, wrong, like the connection between your brain and your mouth has been cut, or the opposite. You speak fluently, but what comes out makes no sense. Word salad. And you can't understand why the person in front of you looks afraid. There are 2 speech centers in your brain. One forms words, one organizes them. When blood flow drops to either, the results are unmistakable and terrifying. The critical mistake people make is waiting for it to self-correct. It passes. They feel embarrassed. They don't want to make a fuss. But broken speech that self-corrects is not a glitch. It is your brain's fire alarm going off and then going silent. The silence is not safety. The silence is the window closing. Warning signal. Number 1, the headache that feels different. Not every headache is a warning. Let me be clear about that. But there is a specific type of headache that neurologists respond to with immediate urgency. Patients describe it as the worst headache of their life. A thunderclap, sudden, severe, nothing like their usual pattern. This type of headache can signal a hemorrhagic event, bleeding inside or around the brain. It is not a tension headache. It is not a migraine. It feels categorically different to the person experiencing it, and that difference is the signal. If you or someone near you describes a headache this way, sudden, severe, unlike anything before, that is a 911 call, not a wait and see. Now, here is the piece of this that most people never hear. After any one of these 5 signals, even if it passed in 2 minutes, you have approximately 72 hours where intervention can still prevent a major stroke. 72 hours. That window does not stay open, and most people spend it convincing themselves it was nothing. Here is exactly what you do instead. Do not drive yourself anywhere. A loss of vision or arm control for even 3 seconds at highway speed is lethal. Call someone. Have them take you. Write down what happened, the exact symptom, which side of the body, what time it started, how long it lasted. Emergency teams need this information, and your memory under stress is not reliable. Do not take blood thinners on your own. This is critical. There are 2 types of stroke. One caused by a clot, one caused by bleeding. Blood thinners help one and accelerate the other. Only a brain scan can tell the difference. Only a medical team can make that call. Get to an emergency department and ask specifically about TIA evaluation. Ask about carotid artery ultrasound. Ask about a 24-hour heart rhythm monitor. Ask about your HbA1c if you've never had it tested. These are not aggressive requests. They are the standard of care. You are entitled to them. Margaret, the retired school teacher from Cincinnati, spent 4 months in rehabilitation after her stroke. When I spoke with her, she told me about the headache 3 days before, the brief moment of confusion the day prior, the morning she woke up and couldn't lift her arm. She said, "I thought I was being dramatic. I didn't want to bother anyone." Pause. That sentence is the most dangerous sentence in medicine. Your brain is sending you signals. It is doing everything it can to warn you before the damage becomes permanent. The only question is whether you are listening. Every minute you wait is 1.9 million neurons. You now know what the signals look like. You know what they mean. You know what to do. Don't wait. If this video gave you something your last appointment didn't, subscribe. Every week I publish exactly this kind of content. Peer-reviewed science, real clinical context, the information you deserve to have before something goes wrong, not after. I'll see you in the next one.